Welcome to Issues. And as you know, Issues is a program that deals with community events. We like to talk to those that are making the news, those who are the headliners in the community. And today we have just the person. She is the CEO of the Bermuda Health Council, Tawana Wedderburn. Welcome, Tawana.
Thank you, Richard, for having me.
It's a pleasure to have you. Before we get into the hard facts of the Health Council, tell us, how did you make it to such an auspicious position as the CEO of the Health Council?
Mm-hmm. Well, Richard, as we were talking about off the air, I actually started my training in Toronto as a clinical social worker, and I worked in several of the Toronto hospitals. Mm-hmm. Completed my graduate training at the University of Toronto and my postgraduate training at the University of Guelph. And then I returned back home to Bermuda and began working at Child and Adolescent Services, which is the Children's Mental Health Services.
And that's where I first met you.
That's
yes.
right, that's right. And as you would know from that work, most of my training has been in clinical care. Mm-hmm. I've worked in hospitals for the time that I began my training. And I've always had a keen interest in the mental health of our population, and specifically how well our children and young people are doing with respect to their mental health care. I moved over to the Health Council in 2007, first on a part-time basis whilst I continued to work at the hospital, and then on a full-time basis later on that year. And that was actually 1 year after the Health Council had began its operations. The Health Council was established in 2006, although its act came into being in 2004. So when I began at the Health Council, I started looking at health professionals and how health professionals in Bermuda are actually regulated. And we developed a framework for health professionals. We looked at those professionals that may not be regulated, and they remain unregulated today. For example, social workers and counselors, as well as those who perform complementary and alternative medicine services, such as massage therapists and naturopaths and so on.
Let me ask you, why the regulation? Why do they have to be regulated?
Regulation helps our population to have a level of assurance of two things: one, of quality, and two, of safety. When you can be assured that the person who is delivering your care is appropriately trained, that they have been through certain procedures, that they have had certain academic learning, in order to say, yes, I am qualified to say what and how an individual might be best cared for. That is very important. So the regulation helps with quality, and it helps with safety.
And so is that the major job of the Health Council in terms of establishing regulations for these different groups?
The Health Council's remit is very vast, and it's not just confined to regulating health professionals. As a matter of fact, the Health Council does not directly regulate health professionals. We do have a monitoring role with health professionals, but it's really the statutory bodies through the Ministry of Health and Seniors that actually regulates health professionals. They are the ones that vet credentials that say that a health professional is appropriately trained to practice in Bermuda. Mm-hmm. The Health Council's role is extended throughout the health system. The first thing that we look at is, are our professionals appropriately trained to deliver care? And we do that by liaising with the statutory bodies and making recommendations for changes. We then ask, are our facilities safe in which the care is being delivered? And that is the regulation of health service providers that you may have heard quite a lot about recently in the news, because we refer to those as the patient safety laws, which I will talk about. And the third component that the Health Council looks at is general health financing. That is, how do we pay for care, and how do we get the money to pay for care? And in that sense, we do have some oversight of our health insurers.
Yeah. Mentioning finance, somewhere along I read where health cost in Bermuda is astronomically high as compared to some other countries. Is there any validity to that?
Yes, there is. So the cost, the per capita cost of health expenditure for Bermuda is just under the United States. So when you compare Bermuda to the OECD countries, or the Organization for Economic Cooperation and Development, when you look at those countries, Bermuda is spending more, and our health outcomes are not necessarily any better.
So we're spending a lot, but we're not seeing that into better health.
Correct.
Any particular reasons that the Health Council may have why that the expenditure does not equate better health?
The Health Council is a 10-year-old organization, and we have been monitoring what we spend on health care and our health outcomes for that long. And I can say that even though 10 years may seem like a long time to a lot of people, it's not a long time in terms of understanding how can we better spend our money to get better outcomes. There are a number of initiatives that are underway to help us achieve that. For example, let's talk about home medical services,
Yes.
right? Home medical services is a benefit where people can receive care in their home. Prior to that benefit being established about 2 years ago, people were receiving care in the hospital setting usually, and that was at great cost. So by tracking and monitoring health expenditure over time, we were able to identify some services that could be delivered safely at home in a more affordable and cost-effective way. These are the ways in which, and this is an example of an initiative in which we can see if we look at the setting in which care is delivered and who delivers that care, we may be able to offer options for that care being more cost-effective whilst also being safe.
Let me ask, and I don't know how familiar you would be with this, Future Care provides in-home care
Yes.
right now. Is that something that came about because of research that the Health Council previously did?
No. Future Care looks at its trending of the population it serves and where there could be opportunities to expand their benefits. In fact, that Future Care benefit, home care benefit, is a great benefit because, again, it allows people to age at home, to receive services at home, and it ensures that those services are delivered by trained professionals coming into the home setting. It is another good example of care which can help lower total health
Yes.
expenditure,
Yes.
and we can see better health outcomes.
Now let's get to some of the nitty-gritty. You mentioned the safety laws earlier. So what are patient safety laws?
Patient safety laws are Bermuda's opportunity to enhance the quality of care by monitoring how safe our facilities are, and indeed by making sure that we can deliver care in facilities and avoid harm to Bermuda's residents. Those laws do three things. First, they require a facility to have a license to operate, and this tells us that our facilities are credible health facilities.
Let's just pause there. When you're talking about facilities, are you just reflecting on the hospital, the 2 hospitals we have, or nursing homes and group homes also?
Bermuda has 334 health service providers or health facilities, which include the hospital, residential and nursing homes, the offices of physicians, dentists, and other health professionals. It also includes the offices of complementary and alternative medicine practitioners, such as massage therapists, chiropractors, those who perform acupuncture, and naturopaths.
Okay.
It would also include those facilities. Any facility that delivers patient care in some way would be captured by the patient safety laws.
Okay. Okay. You mentioned the first one in terms of facilities.
So the first, is the facility credible
Yes.
and offering credible health services? Right. The second thing the laws do is they protect the public from the risk associated with dangerous and high-risk health technology, and specifically medical equipment. And the third thing that the laws do is they say that if you are referred for care in which your practitioner has a financially vested interest, that that care is clinically appropriate and medically necessary.
Okay, very good. Just elaborate on that last one a little bit more so we can get a better understanding.
Okay. So if I go to see my doctor today,
Yes.
and my doctor says, Tawana, I'm going to write you a prescription because your blood pressure is high. And Tawana, I'm writing you this prescription for this pharmacy. I have an interest in this pharmacy. You can go to this pharmacy or you can go to another pharmacy of your choice. That is what the patient safety laws will look at. They will simply say that if you are making a referral in which you have an interest, you must tell the patient.
Okay, understandable. And I do believe several of our doctors' offices now have pharmacies. Some of them also have labs there also.
That is
so if
correct.
my doctor says, listen, I want you to get your blood drawn or tested at my lab next door, he or she has to say, I have a financial interest in where I'm sending it.
Yes.
Okay.
And Richard, most of our professionals are doing this already. And it is really to just ensure that when you as a patient is seeking care, that you are making informed decisions about your care.
Now, in terms of litigation, we know in the United States and some other country, as you turn around, litigation is taking place. To what degree can a patient, either in the hospital or at one of the doctor's offices or their doctor, to what degree does that patient have a right to litigate against that physician?
Several years ago, the Bermuda Medical Council, in collaboration with the Health Council, released a document called the Standards of Practice for Medical Practitioners, or the Standards of Practice for Physicians. That document really provides some guidance as to how a physician will look after the care of a patient. In that document, it talks about things like what should happen to a patient's records, right? It talks about what you should share with a patient if they have to pay for their care. It talks about how you treat a patient when they come into your office. And that document really is kind of the guidance for what is good practice. That document is not just unique to physicians. We have standards of practice in place for nurses, for pharmacists, for allied health professionals, for dentists. And the Health Council is hoping that additional statutory bodies would take up that mantra and complete standards of practice in the fiscal year 2017 and 18. So some of the questions that you're asking are appropriately addressed in those types of guidance documents. And they're available on the Health Council's website. They're available on the websites of each of the statutory bodies and professional associations as well.
Okay. And so those statutory regulations, if a pharmacist, if a physician, if a allied health person doesn't abide by those regulations, that individual opens himself or herself to litigation or to a suit. Am I correct?
One of the things that is very important to keep in mind is that the relationship between a patient and their health professional is a very important one. Yes. And litigation should always be seen as the absolute last step.
Resort. Yes.
And I can tell you, in my many years at the Health Council, in my many years at working at the hospital, I have met health professionals who really go over and above the call of duty to meet a patient's needs, which really minimizes the extent to which we take certain matters to court. The first stop for a patient at any time is always to speak to the health professional. And if you find that you're not able to resolve your issues through that medium, the next step would be to the statutory body responsible for regulating that health professional. And if after you have still are not able to get satisfactory responses, then you can certainly come to the Health Council or to the Ministry of Health as well. Okay. Yes.
We are talking with Tawana Wedderburn, the CEO of the Bermuda Health Council. We're going to take a break and be right back. We're back with Tawana Wedderburn, the CEO of the Bermuda Health Council. We ended our first half. I had asked her a question about litigation, and I was impressed with the steps that she outlined before going to your lawyer and say, yeah, I want to sue my physician. By the way, my physician, he was with one particular office, then moved to another office. I moved right with him. So I like my physician. I've developed a relationship with my GP, and I would advise everyone to really develop a good relationship with their GP. Now, real quickly, just go through those steps again for us before we rush out and get our lawyer. What are some other steps we can take?
If you are unhappy with the care you have received, and there could be a number of reasons why someone is unhappy, first talk with the health professional who delivered the care. Okay. Our health professionals are wonderful, trained persons in Bermuda, and 9 times out of 10, you will be able to resolve your issue there. If you're not successful with speaking with your health professional, you can speak with the statutory body responsible for regulating that health professional. And if after you speak with the statutory body, you still feel that you need additional advice, you can come and speak with the Health Council. And the Health Council really plays a facilitatory role because normally we like to get 2 parties in the room and say, how can we solve this together? Because when people are having and seeing a health professional, it usually means that they're not feeling 100%. And when you're not feeling 100%, you really don't want to be fighting with the person who is delivering your care. The person who is going to give you some advice about what you should do. And so the first approach should always be talk to your health professional. And the Health Council's approach when we receive complaints is always, let's get people in the room and see how we can talk this out first.
You mentioned complaints. Do you get many complaints?
We do. Let me share some data with you, Richard, if I can. In 2012, and if we look at a 5-year trend, in 2012, the Health Council received a total of 198 complaints and queries. Of that 198, only 26 complaints. And I think that is excellent for Bermuda's health system.
Yes.
Fast forward to 2016, we have 221 complaints and queries, and of those, 49 are actual complaints. What we have noticed over time is that complaints have increased, but also the complexity of the complaint has increased. And this is of concern. So every year we look at trends within our complaints and queries, and we ask ourselves, what is it that the public is asking? Why are people contacting the Health Council? And usually it's not just the public. We have quite a number of health professionals that reach out to the Health Council, health insurers, businesses in Bermuda, reach out to us to ask questions about our health system, and sometimes to share with us areas in which our health system could use some improvement.
Now, for 2016, you said there were 49 complaints.
Yes.
In my mind, we have a population of about, what, 10, 15,000 people, about 50,000 people here?
About 62,000 people.
And of that 62,000 people, 49 complaints? That's fabulous, don't you think? And
what's even more fabulous is that the majority of those complaints can be resolved successfully.
Great, wow. So I think that says well about our health professionals here. Okay, let's go a little bit further. Let me throw some questions at you.
Sure.
This person says, I have insurance that will cover my glasses, but my optician charged me for them. I thought they had to bill my insurer.
Okay, so your optician can charge you the cost of your glasses. There was a law some years ago, back in 2012, known as the claims regulations, and many people may remember that as the upfront payments legislation, because that legislation said that if you had health insurance coverage, that your health service provider, the person you go to see for care, has to bill your insurance company. They cannot make you pay for the cost of the visit up front. Those same claims regulations did provide some exceptions to when you must pay out of pocket. So you do have to pay out of pocket for medical equipment and appliances. And part of the reason for that is that many times medical equipment and appliances is provided by companies overseas. And so your health professional needs to pay those companies overseas.
Okay.
Glasses is a good example of that.
Okay. Another question. Am I covered by health insurance when I leave my employment?
Yes is the short answer. Let me explain.
Okay.
There is a regulation known as the cover regulations, and it says that for 4 weeks after you leave your place of employment, you are entitled to health insurance coverage. Most people believe that they are entitled to the same coverage that they had when they were employed.
That was going to be my next question.
The regulations say that you are only entitled to the standard health benefit, which is hospitalization and hospital-based services. So that, and a few select services in the community, such as the home medical services benefit. So you're not entitled to everything. You're entitled to some things for 4 weeks after you leave your place of employment.
Is that similar to HIP?
No. Standard health benefit is different from HIP. Standard health benefit is the basic package of coverage that you're mandated to have by law, and that includes hospitalization and hospital-related services. HIP, which is the acronym for the Health Insurance Plan, is an affordable insurance policy that is offered by the Health Insurance Department that gives you more than hospitalization. It gives you doctor's office visits. It allows you to have preventative dental care. It provides access to overseas care as well.
Okay. Let me back up a little bit in terms of the finance. Copay. Is there a standard copay that's recommended by the Bermuda Health Council in legislation that physicians charge their patients and that optometrists and opticians charge their patients? Or in terms of copay, is that left up to the discretion of the provider?
The Bermuda Health Council does not regulate the fees of community providers. That means that when you walk into your GP's office, your dentist's office, your massage therapist's office, that they can charge you whatever they want for the service. And if your insurance company doesn't cover the total cost, then you will pay as a patient out of pocket. We call that a copayment.
Okay.
The copayments can vary. And the Health Council has been increasingly concerned about the level of copayments in the community because copayments can sometimes act as a deterrent to care. So I know I was at my doctor's office the other day, and when I went there was and without talking about my personal health information, I would have been referred to a specialist for care, and that referral is likely to have cost me upwards of $300 in a copayment.
Wow.
And so I politely said to my GP, what are the other options? And we talked about some other options. So the copayment levels in some cases are really important because in some cases our health professionals are not reimbursed at appropriate levels. Okay, and I think that is very important to make that distinction because there are some copayments that are absolutely legitimate and they help to cover and offset the costs of the care. In other cases, copayments we learn, and remember I talked to you about the level of complaints and queries that we have?
Yes.
Well, I can tell you that for 2016 we had 172 queries, and the majority, a large portion of those queries, had to do with things like copayments and billing and the costs of care in Bermuda.
Let me get an understanding. My health care provider can charge me whatever he or she wishes.
Yes.
Now, of that, the insurer pays a certain percentage?
Correct.
Okay. So it doesn't matter what he charges me, the insurance will only pay a certain percentage. And the percentage that the insurer does not pay then becomes my copayment.
Correct.
Okay, I understand. Okay, another question. Does my employer have to provide me with health insurance?
Yes. The law says that if you are employed, your employer must provide you with the standard health benefit. Most employers will provide more than the standard health benefit. They'll provide major medical coverage, right? But there are 3 cases in which an employer is not obligated to provide health insurance. First, if you are working less than 15 hours a week, your employer does not have to give you health insurance coverage.
So over 15, the employer has to?
Correct.
Okay.
Second, if you are employed for 2 months or less, your employer is not obligated to provide you with health insurance.
Okay.
And third, if you are a student, so those students who come home and work for the summer or the Christmas holidays, again, the employer is not obligated to provide health insurance coverage. I will also add that the America's Cup, as we know, is coming to Bermuda, and there's lots of discussion about the America's Cup. It should be, people should take confidence in knowing that there are some parameters in place for people to be hired under the America's Cup, and they would not be, America's Cup would not be required to provide health insurance coverage as per the legislation that we have in Bermuda. There would be other provisions for them, yes.
Okay. Now, you had mentioned standard health insurance benefit and major medical.
Yes.
What is the difference?
Okay. So standard health benefit is hospitalization and hospital-related care.
In Bermuda?
In Bermuda.
Okay.
Supplemental or major medical benefits is everything else. So it is visits to any health professional in the community, your doctor, your dentist, your nurse in the community. It's home medical services. It is nursing care provided in your home. It is overseas care. It is complementary and alternative medicine care as well. It is mental health care. So if you visit a psychologist or a psychiatrist, that is usually covered as part of a supplemental or major medical benefit.
Okay. Tawana, our time is nearly finished. I have other questions, but let me go back to patient safety laws. Are those in effect now as we speak?
No, they are not.
Okay.
In December, the Minister of Health and Seniors tabled the patient safety laws, and they are 3 separate pieces of legislation. It is expected that when the House reconvenes, the patient safety laws will be debated.
Okay.
The Health Council understands the concerns that have been raised by some health professionals, namely the physician community. And we have scheduled a meeting with the Bermuda Medical Doctors Association to see if there are any outstanding concerns and how we may be able to address those concerns. And that meeting happens next week.
Okay.
The House reconvenes, I believe, in early February.
Very good. We have been talking with the Chief Executive Officer of the Bermuda Health Council, Tawana Wedderburn, that has a wealth of information. I am surprised. Every question we asked her, she had an answer. And I think the Health Council and Bermuda's Health, it's in good hands with you, Tawana. So thank you.
Thank you.
We look forward to having you join us on Issues next time.